Good morning, everybody. Kerryn is from Cape Town, and Kerryn studied music therapy at the University of Pretoria. When I was still there way back, we started the first program in music therapy in South Africa, and it still remains the first accredited music therapy program on the African continent. So it is obviously a flagship program of the University of Pretoria, and all the music therapists who have studied there are still not that many in number. But because it is a program accredited by the Health Professions Council of South Africa, the HPCSA, it means that music therapy and music therapists are now recognized as a significant intervention that can be made in people's lives. The therapists are unidirectional therapists, just like occupational therapists or physiotherapists, and recognized as such. And Kerryn comes particularly highly recommended by the full-time staff in this program at the university. And we're very grateful to her that she was prepared to do this session for us today, because music therapists are still, despite having increased greatly in number, few and far between, and very special people who are very busy and also often teaching music in other situations as well, and working with conditions from early childhood right through to very senior years. So we look so much forward to what you're going to share with us, Kerryn. Thank you so much. And I'm sure that everybody is going to learn a great deal, and there's been a lot of interest in this program. Thank you. And just looking at the introductory screen gives us an idea of the treat that lies in store for us. Thank you.
Thank you, Caroline. I'm really excited to be here, really excited to talk about music therapy. It's something that I absolutely love. It is a very challenging career, but it's also very, very rewarding. So I'm hoping that this is going to be an interactive kind of presentation. I'm really looking for your engagement. So at times I'm going to be asking a few questions here and there, and I hope that you will come to the party and share your ideas as well. So right off the bat, I should say that this really will be a very brief introduction. Music therapy, a brief introduction. There should be a little arrow there that says very, very brief, because as I'm sure you would realize, an hour is not very long, and it would be similar to me trying to introduce you to all of psychology or all of medicine or all of philosophy in this time. But I'm really going to try and open the door to what music therapy is about. Okay, it does have to be a very brief introduction because it is such a wide topic. There's so much detail that you could go into, but hopefully I'll open the door to music therapy for you, and I'm hoping it'll be a very user-friendly introduction. So what I'm hoping we'll get to look at today is what on earth is music therapy, and some types of music therapy, who can benefit, and music therapy in South Africa. Now, before we get into that, I would like to invite you to an active experience. I hope that some of you have a piece of paper and some pencils or crayons or pens or whatever. I'm going to play you a piece of music, and I'd like you to just allow the music to lead you in playing with color or form on your page. And there's no right or wrong. Just draw or color along with the music as the music leads you. So I'm first going to ask you to relax, and then I'll play the piece. So here goes. Please close your eyes at first and take a deep breath in and out and in and out, and let yourself focus and be led by the music. I'll just give you a few minutes to finish up there, come back to the room. Okay, I'm not sure if anybody would like to share their thoughts, their drawing, their experience. Right, hello.
Good morning. The closed eyes experience was predominantly blue today. I just saw blue waves with whales and dolphins, and they frolicked through the music and sort of finally took off underwater with the calf as the final notes arose. When I did it last week, it came in reds and some of the other colors as well, but today was totally peaceful. Thank you.
Okay, thank you very much.
Yeah, so I experienced a lot of movement and definitely colors. First of all, I thought it was yellow and green like in nature. And when the solo part came through, I thought red. And then I felt a lot of water, blue.
There we go.
Thank you. Thanks very
Thank
much. Okay, so thank you for sharing. You might notice some similarities between your experiences and those of others. You might notice some differences. And the point is really that there's no right or wrong. It's really just that music has the power to evoke images, feelings, to tell stories, and to activate creativity. Just an important note, that is not necessarily music therapy that we just did, because I'm not there with you and we can't process it properly, but it might be an experience that is used within a music therapy process. So, what on earth is music therapy? So, music therapy is quite a complex thing to unpack. The truth is that there are a lot of definitions of music therapy because there are a lot of different models and interventions and underpinnings. So sometimes it's easier to first look at what music therapy is not. Music therapy is not someone playing you whale songs or, singing bowls. Music therapy is not simply teaching an instrument for educational purposes. It's also not medical music or music in medicine. And it's not simply putting on background music. So some of those things people do associate with music therapy. They can be important and notable in and of themselves, but they are not necessarily music therapy because it doesn't have a goal and a music therapist. And I'll come back to that in a little bit. So now that we've looked at what music therapy is not, let's look at some of the definitions of what music therapy is. So the first one we'll start with is from the American Music Therapy Association. And here they say that music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So we've got quite a few points there. Then we'll look at the British Association for Music Therapy definition on their site. Music therapy is an established psychological clinical intervention delivered by a registered music therapist to help people whose lives have been affected by injury, illness, or disability through supporting their psychological, emotional, cognitive, physical, communicative, and social needs. So these are the professional bodies for American music therapists and for British music therapists. So now we're going to move on to Sonata. Sonata is the South African body for arts therapists. So that includes music, drama, art, and movement. and it stands for the South African National Arts Therapies Association. Okay, that's SANATA. And their basic definition is music therapy is the use of music as a therapeutic intervention with people of all ages in a process designed to address emotional, cognitive, physical, transpersonal, social, and community needs. And music therapy aims to develop potentials and also improve the quality of life through prevention, treatment, or rehabilitation. In all instances, the use of music is clinically informed, which involves a variety of clinical techniques implemented during musical improvisation, performance, composition, movement, vocal work, and music listening. And it goes further to say, in some instances, the musical activities may extend towards and include extra musical elements, such as talking, drama, art, and storytelling. So there we have 3 different definitions from the various professional bodies of different countries, but there are definitely some similarities, some key points. And you could probably boil it down to this. Music therapy is a non-educational form of intervention implemented by a registered music therapist that uses music in some form to address emotional, physical, psychological, and social challenges. So it's non-educational in that the aim is not specifically to teach an instrument. Remember, I said music therapy is not simply teaching an instrument. As Caroline said, a lot of music therapists do also teach outside of their music therapy practice, but music therapy itself is non-educational. It's a form of intervention, and it must be practiced by a registered music therapist, and that's why our South African music therapists are registered with the HPCSA. It uses music in some form, and then it's a wide variety of challenges that it can address. Non-educational uses musical instruments. It may use pre-recorded music, like I did. It uses improvisation, which is, in the case of music therapy, it's where the music therapist takes whatever the client is playing, because the client doesn't have to have any musical knowledge at all. So the music therapist takes what the client is playing or singing, and in the moment makes up music to incorporate what the client is giving so that a musical process is built. Okay, it involves a registered music therapist. We work with a client or clients in groups and communities. There is a very specific process, and that is client-based. The whole idea of music therapy is very client-centered, client-oriented. And so it is geared towards the client and the client's needs. There's no one music therapy fits all, or there's no sort of program that you can just apply all across the board, because we recognize that people are different and they have different needs and different goals. So there we go to the relevant clinical goals. And these are informed by clinical practice and evidence-based practice. So we're not just sort of making it up as we go along. There are actual studies that show that various techniques will work in various situations, or should work. We can never make the absolute claim that it's 100% going to work, because, as I said, everybody's different. So there's a chance that something won't work for somebody. And then the music therapist, it's their job to adjust what they're doing to really be directive towards that client. So let's look at some types of music therapy, and I'm going to show you a few clips, because just talking about music therapy without seeing some sort of music therapy happening it would be like me trying to explain honey to you if you'd only ever tasted sugar. I can only tell you so much, but you really only start to get a proper picture once I show you something. So the first type we will look at is called creative music therapy. It's also known as Nordorf-Robbins music therapy. They are on the right-hand side of the screen. There is a young boy there who is the client, and Clive Robbins is sitting with him there, and Paul Nordorf is next to him at the piano. Now, Paul Nordorf was a pianist and a composer, and Clive Robbins was a special needs educator. And so they got together and they formed this new method of intervention. And that's why it's called the Nordorf-Robbins music therapy method. It's also known as improvisational music therapy because a lot of it relies on, like I said earlier, the music therapist working in the moment with the music that the client makes. So if somebody were to bang on a drum, the music therapist interprets that and makes it into music. So I'm going to show you a short clip of a Nordorf-Robbins music therapist working with a young man. And just note that, I mean, they might have built upon their music in previous sessions, but she is improvising in the way she is playing according to what he is bringing vocally and the way that he is in the session, his body language, the way he's sitting, the power of his voice. Okay, so let's quickly look at that.
The benefits of having music therapy by Nordorf-Robbins at Tiaf Dalin is just brought so much joy to everybody in the unit, and we always look forward to Thursdays with Lucy.
So about a year into us working together, Matt used his voice for the first time. Matt doesn't use his voice the rest of the week, yet here he was asking to be heard. So I continue to work to incorporate his quite short, gravelly vocalizations into our music, encouraging him to use it more and more, and by doing this together in music, creating meaning and conversation. And the amount of effort he puts in, I think, shows how much he wants to use his voice. And we've continued to celebrate this together in his music therapy.
Music therapy has helped massively during the pandemic. It has given him a platform to be able to still express himself in a creative and fun way. It helps him in many ways, physically, cognitively, emotionally. It has helped him focus, also be aware of others, especially in a group setting, and has also helped him with his patience and turn taking. think it just really opened our eyes to how much more to music therapy there is. It's not just about banging a drum. There's so much more to it, and I think everybody here is like so pro music therapy now. Yeah, it's wonderful. You know, it brings so much to people's lives.
What is particularly special about this type of music therapy, the creative music therapy or Noordhoff Robbins music therapy, is that, as you have seen, the client doesn't have to have verbal processing skills, and the client can actually have limited processing skills overall. What's happening is whatever the client does is being reflected back at them at first, so that they are heard and seen. And then from there, the music therapist moves on with the client to create something. And there's a lot of power in that creativity and that creation. And also, in some instances, people with limited communication perhaps have never actually been able to connect in that way, because the world is so geared towards verbal communication, and then to a lesser degree, sign communication. Oftentimes, the music therapist really has to find the language of the client. Next, we will move on to neurologic music therapy. This is a very specific type of music therapy. As suggested, it works very much in terms of how music works in the brain. It requires extra training and ongoing training on top of a basic music therapy degree. So two types of neurologic music therapy are melodic intonation therapy, and there at the bottom you've got a sort of visual example of what that would be. That is where someone who, for example, has had a stroke and has aphasia, who is not able to access the speech center, uses music almost in a way to sing, because that bypasses the need to just have the speech center working. So they might be taught a phrase, "How are you doing today?" And it might go something like, "How are you doing today?" And through an entire process, it's a very intensive process. They accumulate phrases that they essentially sing, but it doesn't end up sounding as though they are walking around singing. It actually sounds very, very close to just standard speech. I'm going to show you an example now. And then another type is called rhythmic auditory stimulation. And this is used for movements that are naturally rhythmical in and of themselves. So for example, walking, a beat or a song might be specifically chosen for a person who is having trouble walking. For example, with Parkinson's, you might have trouble walking. And this beat is used to improve gait training, because it's kind of like a cue in the brain to step and move forward and step and move forward. Okay, so let's look at melodic intonation therapy.
Hello, 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 hello. I and you. I am bruised.
What's your name?
I am used.
So there you saw youth being quite frustrated initially, unable to communicate to his wishes, to the ability that he wants to. And then you saw a very condensed version of melodic intonation therapy. The clip makes it look quite simple, but it is a very, very labor-intensive intervention. And the client needs to be very committed to practicing these phrases. But as you can see, phrases and speech, they have a natural musical lilt to them. So that's part of why eventually the speech doesn't really sound too unnatural. Then we move on to guided imagery in music. And just a note again, this is not what we did earlier, although it might be incorporated into guided imagery in music. I'm going to play you a clip of basically what it is.
Music and imagery in combination are very effective modalities to use in therapy. We know that music plays a very important role in our life. We probably listen to music every day. It affects our moods and our emotions, and it activates the feel-good endorphins in our brain. Music opens up our whole sensory world. We might hear a tune and immediately associate it with a person, a place, or an event in our lives. And music acts to connect us to the feelings associated with those images. In guided imagery in music, also known as GIM, these images can be visual or kinesthetic or involve all of our senses. And we think of the images as connecting our thinking and our feeling. A unique aspect of GIM is that all of the images are created by the client. They come from the client's inner world. The therapist is there to support and encourage, but the therapist does not direct any of the imagery. As practitioners, we combine verbal discussion, the music and imagery component, and artwork to help the client integrate the experience. GIM was developed by Dr. Helen Bonney, an American music therapist in the 1970s, and is practiced throughout the world. GIM practitioners today undertake 3 years of training beyond their primary therapy qualification.
So basically what happens is the therapist and the client set an intention or a goal, something that they want to process or unpack. The therapist chooses from very, very specifically put together what they call programs or catalogs of music that are created in order to evoke certain feelings or certain processes like rebirth, the hero's journey might be some of them. And then the client then is put into a relaxed state and the music is played and the client talks about whatever imagery comes up. And the music therapist asks various questions about what's happening. And in this way, they go on a journey together. Now, what's important is that the music therapist doesn't ever say, oh, this means that you had trauma in your teenage years, or the music therapist will never input their own meaning into the imagery. And this goes for when the client also draws their pictures afterwards or does their kinetics afterwards. The music therapist asks the client questions so that the client, if comfortable, can unpack further meaning for themselves. But the music therapist never inserts themselves into the process by saying, there's a picture there, for example, with the red dot. The music therapist would never say, oh, the red dot is your core energy and your core energy is angry, for example. That's a trained GIM therapist does not do that. Now, it's important to have extra training because you can actually cause damage if you don't know what you're doing by leaving a client in a very, very vulnerable state, not processing properly. Or, for example, if someone wasn't trained, they wouldn't know to not do this technique with someone who has the potential for psychosis, because someone, for example, with schizophrenia might get lost in this imagery that they create, and it might kick into psychosis. So it's very important to have the proper training. Okay, moving on. We have community music therapy. And this is a type of music therapy that's really been fairly recent in taking off. This acknowledges the community as a client. So it's not simply an individual or 3 or 4 individuals. It's that individual, their immediate circumstances, their immediate environment, their extra environment, the community and what is affecting the community. And we consider all of these as clients and all of them creating feedback with each other. So we understand that the client is not a client in isolation. The client is somebody who is active and acted upon within a community. Okay, I'll give you a quick example.
The Music Therapy Community Clinic provides free music therapy services to a variety of different client groups. We have 3 different projects, namely our Heidefeld project, which is our trauma project, and then something we call the Siapila project, which is our HIV and AIDS project, as well as our Music for Health project.
With all of our projects, we have 2 aspects. We have 2 programs. One is the music therapy, which is where teachers refer children to us that have gone through some sort of trauma and are acting it out in socially inappropriate or destructive ways. Then we also have our after-school program, and the purpose of that is to basically provide a safe space for children to engage with each other in socially appropriate ways, to learn music and to use music as the medium by which to learn social skills.
The first time when I heard that we were going to a music therapy session, it was quite scary by the word music therapy, because we thought we were going to a hospital now, you see. But when we came, it was nice. Mandina showed us to play drums, and what I liked about it is that, like, sometimes you may think bad things, but when it comes to music, it's just you just keep them one side and then you go on with the music.
What we're looking to do is to provide some kind of psychosocial help through music making. And I think the power of music as a tool is that it's something fun, it's something safe, it's a creative way of people expressing the things that they're going through in their lives, and it's a creative way of people figuring that out.
Sometimes by the way you beat it, people can feel how you're beating the music, that when you beat it like hard, people can feel like there's something bothering you, you see. But if the music is nice, then everybody's just dancing and everything. Then you get the good feeling.
What we're seeing the fruits of the long-term work with the Music for Life program is young men, especially 17-year-olds, who are now taking what they've been given and giving it back to their community. So if we could one day, and maybe this is my vision of getting them to then move on to other communities, if we did start something up, they could be the community musicians that we could then employ.
Yeah, I can say it benefited me good, because the other times I wouldn't have, when they speak to, like, scaling me out, like I would just say rude words, but now I just sing it nicely.
So that is an NPO. It's now called MusicWorks. It's an NPO in Cape Town. It used to be called the Cape Town Community Music Therapy Clinic, I think. But they do work in under-resourced areas, and they work with community musicians. So those are people who aren't trained as music therapists, but they are musicians from within the communities, and they work alongside music therapists. And there's a feedback loop that is hoped to be created between the music therapist, the community musician, the children, and the community. So the last one we're going to look at is music therapy in medicine. Now, this is usually creative music therapy based, and it's within the medical environment. So I'm going to show you another quick clip. This is the last clip that we'll look at.
The Jared Curtin Music Therapy Program has been here at Children since 2008. Our music therapists are qualified and trained professionals who specialize in medical music therapy in pediatrics. We serve patients throughout the hospital, from premature babies in NICU through to teens going through cancer treatment or rehabilitation.
The music therapy program has been a great addition to Children's Hospital Oakland. The families love it, the staff loves it, and the patients in particular love it. It's done great things for many of the patients that I've worked with and their families. It's really drawn a lot of kids out.
Just the same as medicine is helpful with kids' pain, we know that music and the work that music therapists do has a similar physiologic effect on the body and can help with pain, can help with anxiety.
A typical music therapy session uses live music, engaging a child in making their own music, either improvising or writing their own songs. We know that live music is more effective than recorded music because a trained music therapist is able to adjust their rhythm, their tempo, their melody to support the patient in that moment, watching their heart rate, watching their breathing rate to support that patient's medical needs.
You can see their face relax, their bodies relax, their vital signs change, their heart rate starts dropping a little bit, more relaxed heart rate, respirations become more stable.
Through music, most kids listen to music. It's almost like they can write their poetry that way, and they can express their feelings through music, whether it's playing music, and it can be angry music, or expressing it through words.
Mama, I need you. Mama, I need you. Please. I need my brother too. My brothers too.
We try to incorporate the music therapy program as much as possible with all kinds of disorders, whether it's chronic pain, because it helps as a distractor and sort of motivates these kids. So we do a lot of co-treatments, meaning that the physical therapist will work with the music therapist, or the occupational therapist will work with the music therapist, and that's very helpful.
And one patient in particular, she was just very stoic, and she went through a lot, and she lost a sibling. She's only 7, and she never cried, and she never wanted to talk about anything. And it was only through music therapy that I got to see her emotional side.
Unfortunately, sick children have a lot done to them, and they are not in control of a lot of things that happen in the hospital, whether it's putting in IVs, whether it's going into the MRI scanner. These are things that are scary, and it's completely out of their control. And so one thing I think that music therapy can do is get their mind off of all this stuff that's being done to them, and it's something that's being done with them.
All right, so that was based with a pediatric unit, but it can also be used with adults. What's really nice is that the team works together in a lot of cases. It doesn't always happen that way, but clients or patients in this context are offered something that is playful, and a non-threatening way to express their emotions and their feelings, their thoughts, which they potentially don't really have a way to do this outside of the music. So who can benefit? you've seen that there are a lot of different types of music therapy, a lot of potential clients that you can have. There are benefits for those with physical difficulties, intellectual challenges, psychological challenges, social challenges, and communities and community challenges. So as an example, for physical challenges, perhaps somebody is a stroke survivor and they are battling with regaining movement. Music therapy can help them practice certain moves and encourage certain movements by placing instruments in different positions. Parkinson's patients, for example, we looked at that type of neurologic music therapy. People with CP, challenges with coordination. The more intellectual side of things, those with learning challenges, Alzheimer's and dementia. Psychological, people with mental illness, general personal development. The social side of things, people in difficult social circumstances, people with family problems. And in community, there's the at-risk youth or adults and under-resourced communities. And there's a lot of crossover between these. So, you know, I might be working with somebody who has severe depression, and that might fall under the psychological branch. But there's also a social element to that and a community element to that, and even a physical element to that, because people who are depressed potentially move a lot less. It goes with their mood. So let's quickly look at music therapy in South Africa. So as Caroline was saying, a music therapist in South Africa has to be registered. You get some people who call themselves music therapists, but they haven't gone through the proper training. And as I mentioned, you can actually do some damage if you aren't properly trained. So it's important, if you ever want to engage the services of a music therapist, that you ask if they are registered with the HPCSA. They should be able to give you a number that is their registration number. So we need the appropriate training, and that training has a theoretical component, a supervised practical component, a number of hours of actual practical work that is supervised. And it also has a research component. And this in South Africa falls into a master's degree that is offered by the University of Pretoria, and it's the only music therapy degree at the moment within South Africa, and the only accredited one within Southern Africa. And there again, you have to be registered with the Health Professionals Council, and that also ensures that we have the qualifications and ensures that we follow certain ethical guidelines that are put in place by the HPCSA. So I myself work with an NPO, MusicWorks, that I told you about earlier. I work with youth at risk in one of the places that has prevalent gangs and drugs and alcoholism. So I work at a school, and it's not a therapy process per se. What we're working on is the resilience that the children have already, as well as general social skills and emotional wellness. And I work with a number of community musicians. So there are therapeutic goals, but in a lot of ways, it's not strictly music therapy. And then I do work with children who have intellectual and physical disabilities and challenges. That is a strictly music therapy based intervention. And I also work in groups and with individuals who have Alzheimer's and dementia. This I have, Caroline said, this is potentially an area of interest here. So music therapy can have a lot of benefit for the elderly client population, those in frail care, those in dementia care units, those with Alzheimer's. There are a lot of aspects that music therapy can address, including social engagement, because, you know, one of the things in, for example, a frail care unit is the staff are overtaxed, the residents are particularly possibly under-engaged. So we could do music therapy groups, which encourages intellectual and social stimulation, and also physical, because, you know, there's always the possibility of getting up and dancing or moving around in a wheelchair, for example. And work with someone with dementia or Alzheimer's. This would be very specific to the client. Again, music therapy is a very client-centered intervention, but you could work on things like identity, memory, not necessarily improving memory, but accessing memory. So at certain stages, you might be able to play songs from somebody's past, and this would engage their memory of that and of identity. You could also work on movement. You could also work on social interactions, because one of the things that happens with people with dementia and Alzheimer's is that their world gets smaller and smaller and smaller. But again, this would be very, very specifically based on the client, on the client's needs, because we do work according to those goals that are important in that situation. I hope that makes sense. And general quality of life. I think music therapy can really boost the general quality of life. I'm obviously an advocate. Okay, so I do have just the names of the clips there. And before we go to questions, if you did want to engage the services of a music therapist, the easiest way would be to go to the Sonata website. That's the music therapy, or the arts therapies professional board. So it's SANATA, Sonata. And if you just look them up, their site will come up. And there should be a list there of music therapists, but it's also easy to just contact the contact person. And what happens is they send out a referral note to the music therapy community or the arts therapy community and ask if anybody is available in the area. So I don't know if anybody has any questions.
Thank you, Kerryn. That was absolutely fascinating. Thank you very, very much. Let me see if there are any questions.
Morning, Kerryn. Thank you for a very, very interesting hour that we spent with you. I was fascinated by your use right throughout, with just one exception, of the word client as against patient.
Yes.
Is that personal to you, or is that part of the philosophy of the music therapy movement as a whole, that in a way you sort of look at the challenges that you've got from the point of view of the half full bottle as against the half empty bottle? It's
Absolutely.
Sort of philosophical type of approach.
Yes, that is thank you, good question. That is a philosophical underpinning of the arts therapies in general, and the way we are taught music therapy in South Africa, that we don't approach it from the medical model where it's a patient and their pathology is at the forefront. We approach it from a humanistic model where the client is centered. It's a very Carl Rogers approach where the client is at the forefront. The client is made up of somebody who has a whole lot of potential and may be experiencing some difficulties in some area. So we don't look at it as a pathologized situation. We look at what the person can do, and we try to maximize that.
Thank you. Thank you. Any other questions? Yes.
I have a rather strange question. Do you have any use this anywhere on animals?
I don't know of any that is used. I do know that music in general can be used, but I don't know that there are any music therapists who specialize with animals. I do know that sometimes music is used to calm animals, particularly I think in in hippotherapy with equestrian with horses, but not that I know of specifically music therapy wise.
I wondered about production, you know, making chickens lay more or calming cows.
Okay. I'm afraid I can't speak to that. It's a good question.
Okay, thank you.
We'll have to ask Prince Charles. Kerryn, that was absolutely fascinating and actually very, very useful as well. Thank you so much. Thank you for making yourself available for this presentation. Much appreciated, and good luck with the very valuable work that we can see that you do. Thank you and good luck, and go well.